Many people have probably never even heard of the procedure of forehead flap for nasal reconstruction. Like so many things in facial plastic surgery, it's a beautiful blend of art and engineering, and one of the reasons that I find it one of my surgical passions. When you're studying somebody who's missing a large part of their nose, again, one must be part artist and part engineer. The artist in me, the first thing you have to do is study what's still there. Often when I meet a patient for the first time and I start drawing on their normal side, they're kind of like, "Hey doc, that's the good side." And I was like, "Of course." But you have to study the normal side to begin to see what's missing after the skin cancer, the dog bite, or some other malady. In this gentleman's situation, we're going to be able to take his cheek and scoot it inward. Luckily, cheeks are fairly flexible, so we can move the cheek closer to here where shadow will hide that final incision. And then we're going to have to completely rebuild his right nostril. This is where it really gets fascinating. The way that our foreheads are put together is we have blood vessels that come out right near the inner parts of our eyebrows. And these blood vessels run straight up our foreheads vertically, such that you can study what's missing and basically design the missing body part. In this case, he needs his right nostril reconstructed. So we're going to design a right nostril far enough away up his forehead and create this relatively thin strip of skin. We sometimes call it a stalk, S-T-A-L-K, a stalk. And this comes down, and then you can imagine three-dimensionally this piece of skin actually leaves the forehead and comes down to the nose, still connected by this very important stalk of skin, because it's within this strip of skin that the blood vessel is providing a stable blood supply so that while the skin is temporarily attached here, it can be nourished. After about 3 weeks, the surrounding skin will support the transferred skin, and then you can divide what we call the pedicle. And because the strip of skin was relatively narrow, and thank goodness our skin has some stretch to it, you can take the edges of your forehead and they will stretch and they will come back together. And in the end, after a few surgeries, you can have a more normal looking nose again. And the incision on your forehead is just a fine linear line that often most people won't even notice. That, my friends, is how a forehead flap is created.